नमस्कार, मैं हूं आपके साथ कविता थपलियाल और आप देख रहे हैं कंज्यूमर इज किंग। अक्सर अखबारों में खबर आती है कि गलत इलाज की वजह से मरीज की जान चली गई। अब ऐसे में हम सोचने पर मजबूर हो जाते हैं कि आखिर एक डॉक्टर गलत इलाज कैसे कर सकता है। दरअसल ज्यादातर ऐसी वारदातों के पीछे छोला छाप डॉक्टर्स यानी अनक्वालिफाइड डॉक्टर्स ही वजह होते हैं। लेकिन अब सरकार इन छोला छाप डॉक्टर्स का इलाज करने जा रही है। कैसे, जानने के लिए देखिए ये रिपोर्ट।
एक कहावत है, नीम हकीमे खतरे जान, यानी अनक्वालिफाइड डॉक्टर से इलाज मरीजों की जान पर आ सकती है। और अब सरकार ऐसे झोला छाप डॉक्टरों पर सख्ती बरतने की तैयारी कर रही है। सरकार का इरादा हेल्थ केयर प्रोफेशनल रजिस्ट्री यानी HPR की शुरू करने की है, ताकि झोला छाप डॉक्टरों की दुकान बंद की जा सके। HPR के बाद सिर्फ वही लोग मेडिकल प्रैक्टिस कर सकेंगे जिनका एनरोलमेंट इस रजिस्टर में होगा। नेशनल रजिस्टर में सिर्फ डॉक्टर्स ही नहीं बल्कि नर्स और पैरामेडिकल प्रैक्टिशनर्स का रजिस्ट्रेशन भी कराना जरूरी होगा। इंडियन मेडिकल एसोसिएशन की माने तो फिलहाल हमारे देश में सिर्फ 15,000 रजिस्टर्ड प्रोफेशनल्स हैं। इनमें करीब 16% प्राइवेट सेक्टर से हैं, जबकि देश में फिलहाल 10 लाख लोग मेडिकल प्रैक्टिस कर रहे हैं। इनमें 6 लाख एलोपैथिक ट्रीटमेंट करते हैं और बाकी आयुर्वेद, सिद्ध, यूनानी और तिब्बती तरीकों से इलाज में लगे हैं। इस HPR में रजिस्ट्रेशन के लिए प्रोफेशनल्स को रजिस्ट्रेशन सर्टिफिकेट, डिग्री, डिप्लोमा और सरकारी डॉक्टर या नर्स होने पर एम्प्लॉयमेंट प्रूफ जमा करना होगा। उस स्ट्रीम से जुड़ी संस्था जैसे नेशनल मेडिकल कमीशन, डेंटल काउंसिल ऑफ इंडिया, नेशनल कमीशन फॉर इंडियन सिस्टम ऑफ मेडिसिन और नेशनल कमीशन फॉर होम्योपैथी की ओर से वेरीफाई किए जाने के बाद ही उन्हें मेडिकल प्रैक्टिस का अधिकार होगा। सरकार आने वाले कुछ महीनों में इस नए सिस्टम को पूरी तरह से लागू कर देना चाहती है, लेकिन सवाल ये उठता है कि इस सिस्टम के आने से भले ही झोला छाप डॉक्टरों की दुकान बंद हो जाए, लेकिन क्या इससे लोगों को इलाज की सुविधा मुहैया हो पाएगी? क्योंकि हमारे यहाँ मेडिकल ट्रीटमेंट लोगों तक पहुँचाना सबसे बड़ा चैलेंज है। ET नाउ स्वदेश।
चलिए, तो कहने सुनने में सब बेहद अच्छा नजर आता है, लेकिन अब यहाँ पर बड़े सवाल भी उठते हैं। सवाल ये है कि HPR से मेडिकल प्रोफेशनल्स को आखिर कितना फायदा होगा? डॉक्टर्स का डेटा तैयार होने भर से क्या मेडिकल फैसिलिटीज आसानी से पहुंचने लगेंगी? ऐसे तमाम सवालों के लिए हमारे साथ आगे चलकर एक पैनल भी जुड़ने वाला है। लेकिन चलिए यहाँ पर आपको बताते हैं कि किस तरह से झोला छाप डॉक्टर्स की भरमार है। हम आपको बताएं तो अब तक जो रजिस्टर्ड मेडिकल प्रोफेशनल्स हैं उनका जो आंकड़ा है वो केवल 15,000 का है, जबकि अगर आप गौर करें इस आंकड़े पर तो लगभग 10 लाख लोग जो हैं वो मेडिकल प्रैक्टिस कर रहे हैं, यानी वो डॉक्टर्स ऑलरेडी हैं। अब इसमें से भी अगर हम आपको बताएं तो लगभग 6 लाख एलोपैथिक ट्रीटमेंट करते हैं इन 10 लाख में से, और 4 लाख जो हैं वो आयुर्वेद, सिद्ध, यूनानी और तिब्बती तरीके से इलाज करते हैं। यानी जिन छोला छाप डॉक्टर्स की हम बात कर रहे हैं उनकी तादाद इतनी ज़्यादा बड़ी है कि रजिस्ट्री के मुताबिक केवल 15,000 मेडिकल प्रोफेशनल्स ही हैं जो यहाँ पर निश्चित तरीके से रजिस्टर्ड हैं। और हमारे साथ हमारा पैनल भी जुड़ गया है। हमारे साथ अब जुड़ रहे हैं डॉक्टर J.A. जयलाल, इमीडिएट पास्ट नेशनल प्रेसिडेंट IMA, डॉक्टर नरेंद्र सैनी, मेंबर दिल्ली मेडिकल काउंसिल। आप दोनों का स्वागत है हमारी इस पेशकश में। और जयलाल जी, आपसे सवाल यही होगा कि HPR की जो फैसिलिटी है ये क्या पहले से नहीं थी, और अगर थी तो इसमें रजिस्ट्री मेडिकल प्रोफेशनल्स की अब तक क्यों नहीं की गई, इसको अपडेट क्यों नहीं किया गया?
Sorry, I will not be able to answer you in a Hindi back. That is
कोई बात नहीं सर।
You mean to say that is why there is a unique ID is needed for that?
क्या कह रहे हैं सर आप?
No.
मेरा सवाल आपसे ये है कि हम HPR की जो सुविधा है उस पर बात करना चाहते हैं जहां पर मेडिकल प्रोफेशनल्स की रजिस्ट्री की जाएगी।
I'm sorry.
So, sir, what I'm trying to ask you is the facility of HPR, as per this rule, we'll be having new medical professionals, or in fact, all the medical professionals registered as per this. So, why did you think it was necessary to do this?
Oh, in fact, Indian Medical Association, we are not for this unique ID program which the NMC is now creating, because what we feel there is a health is a state subject. The individually each state, somebody who is registering must have the control over them. The purpose of medical council of the state is to have a control over the medical doctors who are practicing in that area. When you are having instead of that individual state registration, if you are going to have a national UD, the control has to be in Delhi. So if someone is practicing in the remote corners for any appeal, any ethical misconduct, any issue, they all has to come to the Delhi, that is which is centralizing one. So the system which we are practicing at present now, it's each state is registering. Each state, after registering only, they will be able to practice. When they are going to shift from one state to another state, and it is a reciprocal registration is also given. Only thing, they wherever place they are going to practice, they should get some control over the state party. So we are insisting on that. Health is a state subject, and the maintenance and of the doctors should be with the state. The needs of each state is different. The needs and necessity of each state is different. The rules and regulations are also, though uniform, there is a subtle difference are there. So that's the first thing. But the government is trying to make a uniform ID, just like they are trying to bring for a car and they are trying to bring for the vehicles. So this is a long drawn, because it is everything now it is computerized. They are trying to make it. But two registration or this unique
It will
registration
be beneficial if the government does this, because so far what we are seeing is you have at least 10 lakh medical professionals who are already practicing, whereas in the registry, the medical professional registry, you have the list of only 15,000 people who are registered medical professionals. This also gives way to unqualified doctors.
No, see, that is what, because the central is maintaining, that is the register we are changing. But each state, if Tamil Nadu, now there is a 1,55,000 doctors are registered. Kerala, there is almost 50,000 doctors are registered. Maharashtra, there is 1,75,000 doctors are registered. So these are the registered with the independent council in the particular state. Now we are going to convert it to a national uniform ID, human resource index, they are going to create that. So that will have a difficulty in bringing all these people, because some of the people are now working outside foreign countries, some of the people are in a remote areas. So those, it will be difficult. I don't think there will be any greater advantage will come by identifying a single number. There are so many other means to avoid the quackery. There is so many other means to.
Such as, if you want to elaborate on that.
Yes, see, if you are giving a power to a state, if the government is taking the control, it is all the 1,50,000 doctors of the particular state or the 1 lakh doctors, their ID, the QR code, their entire details can be available with that. Any prescription which they are giving and has to be given only with that QR code or that number. Now, most of the states are following Clinical Establishment Act. In the Clinical Establishment Act, only when you are registered with the council, you can get registered your clinic. So those who are not having the Clinical Establishment Act, or those who are not having the registered number, if the counter sales and if the prescriptions is coming, government should vehemently take some action against this squad. Then definitely we will be able to have a control over that. So now Tamil Nadu state, I am just quoting, if you have a registration number, always it has a QR code. So any person who is coming, you can check that whether the doctor is really registered or not. That is, it is possible to implement in our country. But if you are going to make a unique ID, and that is entire state, entire people of the country is going to register in a single area, and it will be very difficult to identify these people, identify the people where they are practicing, what they are practicing, where they are practicing will be literally a difficult one. So this is not a means to avoid quackery. There are so many other ways which already IMA has recommended to the government to adopt to that. But since the government is so vehemently involving in the registration of the ID, what we are advising to, it cannot be a unique ID, independent unique ID. It must be only incorporated with the, it's just a duplication of what the State Registration Council should be done, not abolishing all the state registration, making a central ID. That will not be a alternative solution for that, and we are not going to support that issue.
But now the problem still remains about the unqualified doctors, sir, which is why I'm trying to stress on this point that maybe because of HPR, we might just see this number coming down, because that is a very big concern. We are talking about people's lives. Now, to have these unqualified doctors removed, we need a robust system. What do you suggest? State, if according to you, this is a state's matter and the state should be taking the responsibility, what actions should the center suggest that the states should enroll to ensure that there are no unqualified doctors?
Every state has nearly 20 to 30% of the people now unqualified people are there. The government should come out and what is the qualification they are saying? What do they mean by qualification of the unqualified people? There are two sets of unqualified people are available in our country. One is the people who have never studied any system of medicine by +2 or SSLC, by just mere practice. They post them as a doctor and they are practicing. That is one group of unqualified people. And second group of what we are insisting also, that is one group that is a very negligible number. But another group is also there where we are having in India, we have a different systems of medicine. Either you are a modern medicine, you have an Ayurveda, Unani, there is a different system. Each one is qualified in their particular system. But those who are qualified in a one system, when they are practicing other system of drugs, other system of medicine, that is also a mixopathy or that is also a quackery. And how we are going to reduce that quackery. So the government should come out. Now I am so thankful the NMC has coming with the proposed amendment that other than modern medical people cannot use a modern medical drugs. Similarly, they are going to bring for Ayush. Those who are trained in Ayush, they should use that Ayush system. That is a wholeheartedly welcome issue. But if the government is not deciding and defining what is unqualified people practicing medicine, then it is going to be a big challenge. Then every court is giving in a different ruling. Every court will come out at a different point. We will not be able to see. So first, the government should issue who is a qualified doctor, who is a non-qualified doctor. Second, who has the right to practice the particular medicine. Those who have finished our MCA regulation, section 15 says only those who get an MBBS degree has a modern medical practice. So such kind of stringent rule should be coming. The third, if there is anybody who is involved, it is not that the affected people has to complain. Even if an organization or association is making a complaint, a list of quacks who are practicing, the government should take a stringent action. As on date, there is no law which punishes them. A maximum punishment you can give to a quack or unqualified person is 500 rupees. There are people, they are willing to pay 500 rupees in advance and they ship the place and they will again start practicing. So the special law should come for abolishing this anti-quackery. Anti-quackery law should come. Anyone who is practicing, it is like a homicide. If someone is practicing without medical knowledge, doing a medical practice and killing somebody, it is a homicide. So such a stringent law should be there to punish them. There is no law that is available. So only when such kind of things are coming out, the clarity is coming, we will be able to reduce that. Fourth, why there is quackery, we should also there. It is only in our rural areas it is going. The infrastructure development is not there. So when we have enough doctors, every year 1 lakh modern medical people and almost 50,000, 25 to 30,000 Ayurveda people are coming out. So if all these people are placed accordingly in a definite place, and definitely we will not have a shortage of doctors, we will not have the quackery. So if the government makes administrative decisions, administrative reason, definitely we will be able to bring down. So it is not the fault of the system, it is the fault of the administration. That is why the quackery is thriving in this country.
Yes, that we have an HPR or maybe a uniform system where we have different allopathic doctors, Ayurveda and Unani and Tibetan and all the kind of medical practices that are being practiced. Do you think there should be a system where we can differentiate and bifurcate these kind of medical professionals?
Of course, our parliament has already defined that. The parliament has, by in its wisdom, has said what is modern medicine, what is Ayurveda, what is Chitta. That is a standard protocol is there, standard text is there. If the over jealously, we are making a mixopathy. We are saying that we can mix everything into it. We are not against any system. A human being needs multiple system of doctors. Somebody you have an allergy, somebody you have a chronic disease. Each system is unique in that way. So the people who are trained in one system should only practice their system. Same person may need multiple system of doctors. A person can give Ayurvedic medicine, the person, another doctor can give a homeopathy medicine. that is natural. In this country, we need such a different system of medicine. But we should not allow a qualified person in one system to practice. A car driver should drive only car. He should not be allowed to drive a plane. That will be always a difficulty. So that is what we are insisting on that. So both are important. Unqualified people doing practice is also important, but one system of people doing other practice is also a dangerous trend. But that should be avoided in this country.
So talking about non-qualified doctors, how much do you think we have them in the rural areas if you talk about tier 1 and tier 2 and tier 3 cities?
No,
in terms of numbers?
It is not only in the rural area, even in the metropolitan cities, we are seeing the unqualified people in the name of even unqualified systems of medicine. There somebody calls them electropathy, somebody is saying the colorotherapy, somebody calls them a music therapy, and somebody in a different names. They are doing all doing a modern medical drugs they are practicing. It is happening right now in the metropolitan cities. In the rural areas, this is much more it is happening on that rural area. Now, in an average, we see if there is a 10 lakhs doctors, nearly 3 lakhs quacks are also thriving in this country.
Talking about global standards, how do you think these kind of uniformities are maintained over there?
So, none of the countries, every country has a different system of medicine. China has a different, their indigenous system, but none of them are mixing the system and practicing. And if it is very necessary now, MCI in its wisdom has decided not only the modern medical doctors has to register, but they have to re-register also once in 5 years. So after every 5 years, they have to upgrade their skills. They get 30 hours of credit hours by doing lot of training, lot of CME programs. So only when they prove that they have done already 30 hours of training, their license will be renewed. So that is a strict implementation. Some of the countries in the Western countries, they do it every year. Some of the Jamaica and others, even a small country, they do even test they are making for a modern medical doctor. For every year, they have to write the test. And if they score some reasonable mark, then only they will be able to go for the next year practice. So that kind of system should come into our country also. Modern medical person with an MBBS degree registering, it is available only for 5 years. And after 5 years, if he is not equipping himself, empowering him the new skills and knowledge, and he cannot be continuing the practice. So that kind of a stringent rule, because it is dealing with the life and death of the person. Today, iatrogenic defect or the hospital treatment induced problems are the highest catastrophe. Almost every, we say there is a 10 to 15% of the disease or the accidents are happening because of the hospital induced problems. One is on the quack or the unqualified people doing the practice. So to be controlled that, even for the qualified people, there must be some stringent measures to upgrade themselves. Then only we will be able to improve the health standard of our country.
Exactly. Upskilling is very important, in fact, not only for doctors, but then professionals from every field. Your question to you is, which is a bigger problem, non-qualified doctors or lack of medical infrastructure?
No, at present, I will say only the lack of infrastructure, not only medical infrastructure, lack of infrastructure. If there is an infrastructure of the country is there, definitely we will be making it the good medical thing. See, a doctor cannot go to the rural area when there is no hospital, when there is no paramedical people, when there is no even a place to sit and do a practice. So if you can make infrastructure available, infrastructure improvement, slowly we will be getting. What is happening in South India when you are comparing with some of the states in the north? So South India, now there is an excess of doctors. You cannot find many areas where there is, almost all places, including the inaccessible terrains, are now having the medical infrastructure because the infrastructure of the places are improved. So overall, built-in infrastructure is the most important tool to develop a high infrastructure. Second most problem, the oversaturation of the infrastructure. If you see the metropolitan cities or our higher cities, there is people are pooling there, super specializations are increasing, subspecialties are increasing, and that is also becoming a problem. Comparing to the Western countries, where the family medicine is the concept, you cannot go to a super specialist bypassing your family physician. See, if India is one country, we are not yet, though it is a birthplace, family medicine birthplace is India, we are now forgotten family medicine, forgotten the family doctor concept. We are only talking about the corporate hospital and super specialty hospital. So that infrastructure excess is also a problem which is happening in the city for the excess expenditure the people are getting and excess disease are getting. So for that, one, the rural infrastructure should be increased. Second, the family medicine concept or the family doctor concept should be revisited and re-strengthened. A very primary health center, a doctor should be there who is qualified and trained in family medicine, where he will be able to have continuous, comprehensive, cost-effective, community-oriented healthcare he can provide. So if the country government is thinking on the family medicine concept, I think the most of the time we will be able to solve the issues which the country is facing today.
All right, coming back to the HPR issue where the government is trying to get away with the non-qualified doctors, and according to you it's a state's matter and states should be actually making guidelines and dictating what should be done to remove non-qualified doctors, because here we are talking about saving lives of people. According to you, which is the quickest way or a draft notification or any guideline that a state can draw and for the medical fraternity, what can be done? Like the quickest fix for this problem?
The quickest fix is the strongest punishment. And if the government comes out with a quackery eradication law, where if they says anyone without a particular qualification, if he is involving in the medical treatment, if there is any information, it is coming to the government and they will be strictly punished. See, now information system is great. In a village officer or a taluk panchayat officer or a district collector, without his knowledge, nothing can happen in that district. All that what is happening in the district, how many quacks are in the district, it is already available with the district administration. In many places, Indian Medical Association itself has handed over the people who are doing a malpractices. Only thing, when they go to the court, it is very difficult for them to prove because law is not sufficient to punish them. If the government now comes out a stringent law, that is only qualified people should do the practice, and if someone is found guilty, and they will be punished in a fast track court model, and then only we will be able to make a quick fix. And second, to improve the health access, all the public health hospitals should be improved to make the public health hospital more accessible. The government of India should spend the health budget should be more. Hardly ever, repeatedly we are asking, our maximum budget allocation is only 1.5% of the GDP. And Western countries, minimum 6 to 8% is the GDP they are allotting for the healthcare. And now, unfortunately, slowly the hospital healthcare is going towards the public health system. From the public health, it is going to the private health system. So, government should increase the public health system. The third, the government should bring the universal access or the insurance system to available. That insurance should be win-win situation. Hospital and the people should get the benefit. The penetrability of the insurance in our country is only 10 to 15%. But if you can make the insurance system is penetrable, and every last man of this country is ensured that he will be able to get appropriate medical care when he is coming to an hospital, whether it is a public or private, then the quackery issue will not be coming. See, if the government is able to do that, it is not a big thing. If there is a will, there is a way.
Definitely, definitely. Thank you so much, Dr. Jailal. All in all, HPR is not enough to get rid of non-qualified doctors. We need a rather robust infrastructure and system in place. Thank you so much for talking to us. चलिए आगे बढ़ते हैं और अब सीधा रुख करेंगे खबरें फटाफट की ओर।